Okay, beautiful PE46 people. I'm hoping that this is working. I hope that you can all hear me. I will ask if one person would do me a solid and ask a question so I can make sure that my questions are working. If anyone out there, and you might have, and I can't see it. And if that's the case, I'm going to fix it. So, okay. Well, you lovely people, we are going to go ahead and get started this morning. Welcome to the PE46 webinar that I am now affectionately calling What's the 411? Our October PE46 webinar. So, to get us going this morning, our agenda, we will do some welcomes and introductions, general updates, a new section that I'm calling Everything PE46. We will introduce our special guests from 211 Info, and then we will ask or try to answer any and all questions that you all might have. And I'm going to give a warning now that we are having some technical difficulties with our questions bank, so I am going to be trying to solve that dilemma for us as 211 is doing their presentation. So if you're asking questions, please note that we will answer your questions before all is said and done here. So friends, should we do some practice polling? I know that you all love it so much. We will be doing live polling again through this webinar, live participation via Poll Everywhere. Via text, you can text PE46 to 22333, or you can participate on the web via this web link listed. If you are participating via your cell phone, it will look something like this. If you are participating via the cell phone and a web browser, this is what it might look like for you. So, shall we do a practice poll, my friends? In one word, what county do you represent? In one word, what county do you represent? Coos in the house, Jefferson, Jackson, Umatilla, Columbia, Clackamas, Lynn. So we'll give it a few seconds for everyone to insert their county. Thank you all for showing up and participating. Let's try another poll. Question for you. Did you check out the PE46 website? Yes or no? Looks like a lot of people did not. I don't blame you. There's not a lot there. However, there is some things there, so perhaps after today's webinar, you might venture onto that website. Next poll. Did you check out the county profile tool? It was located on the website, so if you did not check out the website, then you perhaps did not also see the county profile tool. No worries, 100% of you who did not check out the county profile tool. As it turns out, I have not removed it from the website, so it is still available for you to take a gander at. All right, fun polling questions for this morning. So let's just get right into some general updates. I wanted to give you all a heads up that I do plan on sending out a survey next month in the month of November specific to these PE 46 webinars. I'm not doing these webinars for me, I'm doing these webinars for you. So I want to make sure that I am getting all of the topics as far as content for guest speakers that you are interested in, as well as I want to make sure that this date and time works. As of now, we have this scheduled through the first of the year, but there's no reason why we can't look at a different date and time if it works better for other folks after the first of the year. And I'm completely open to that. Next announcement, our November PE 46 webinar will take place November the 30th, 9 a.m. to 10 a.m. And this is a slightly out of order of our fourth the fourth Friday of the month, only because of the holiday. So please note that our November PE 46 webinar will take place November the 30th, 9 a.m. to 10 a.m. And our guest that day will be the Screenwise program. Again, I want to give you lots of shout outs to the PE 46 webpage. We will be posting all of our PE 46 web pages, or rather webinars, to our suite webpage every time we make one. What I'm learning is it's not as easy as I had thought it would be, but it's not as hard. So it might take me more than 7 days, but I promise you, I'm learning how to do everything at the state, and we'll make it awesome for you. So let's talk about everything PE 46. And I realize that PE 46, I feel like people are starting to get the groove, but we have a few questions, and I just want to make sure that everyone feels confident. So if you attended the coordinators meeting, you may have seen this slide, but I want to just go over it one more time for you. So local public health authorities, they're really focused on access to reproductive services anywhere and everywhere within their community. So for the purposes of PE 46, this really means developing partnerships to assess and increase access to reproductive health services. If you're a clinical provider, the focus is on your reproductive health program. So it's the community participation really is involving community in developing and implementing and evaluating your reproductive health services at your specific clinic. The project promotion and education will look more like marketing your specific reproductive health services. So I'm hoping that this slide helps to illustrate that the work of PE 46 is outside of the scope of your clinical, if you're still providing clinical services, and more, how is my community able to assess and increase access to reproductive health services as a whole? So again, you are already doing a lot of this work. You're probably already promoting your clinical services if you still provide clinical services via fairs, radio spots, websites, the newspaper, social media, and you're probably already doing a lot of education. You're talking at schools, you're going to school-based health centers, boys and girls clubs, health fairs, participating in various coalitions and advisory groups. We're asking you to take it a step further with PE 46. And we really want you to think about who your community partners are, how you're engaging and developing those relationships. So new partners, and I want you to think outside of the box for this, might include faith-based organizations, juvenile services, mental health, migrant farm camps, or treatment centers. Your current partners are WIC, Nurse Family Partnerships, school-based health centers, and federally qualified health centers. So really think who is not at the table, who might have an important voice when it comes to accessing reproductive health services within our community. So I'm hoping this helps clear up some of the questions that you all might have around PE 46 and what exactly is it. As a reminder, this all connects back to public health modernization. And you're going to hear me continue to talk about public health modernization. And again, I recognize at the local level, Nobody cares about modernization. I'll be the first to say it. They just don't. But where it matters is that I think that we're going to be able to see money in the long run connected to how we're able to talk about reproductive health in the connection to modernization. So when people ask you about public health modernization, you can tell them that PE 46 is really looking at equitable access to health services. We're looking at community partnership developments. And then we're also looking at health equity and cultural responsiveness. Okay. Nope, I
Still hear myself.
Technical difficulties. Sorry. Okay, perfect. All right. So, again, public health modernization, it matters, even though it might not feel like it matters. Questions, comments, and our questions box is officially up, and any of the questions that you ask will now be visible. Sweet. And we got your test questions. Thanks for sending me those test questions. Okay, so since there are no questions, I assume that I've done an amazing job explaining yet again PE 46, and you all are super brilliant, and you have no questions. So I applaud you all. Okay, fiscal update. I am so happy to introduce my sweet fiscal team. Without any further delays, I give you Erin, the fiscal diva.
Good morning. Fiscal updates on PE 46. As you all should be aware, there was an email that went out talking about the delay in both the amendment and, of course, payments. Recent update is that many of the contracts did go out. The September amendment contracts did go out this week. It seems to be done in alphabetical order. So any agencies that start with A through L, those contracts were issued this week. The remaining will be, I am told, by end of day today, all of the contracts should be out. As to payments for PE 46, we will need the amendment contract signed and returned to us before we can actually start issuing payments. What we will do once we have your signed contract, we will provide a catch-up payment. So the first payment that will be issued will include any payments that were due from the start of the contract, which was September 1, through the date or month that we receive your signed contract.
A short and sweet fiscal update for you. So, without further ado, let me see. Questions? Does anybody have any fiscal questions for us while Erin and Dominic are still in the room? Nope, no questions. Sweet. The money is coming, is what I want to tell you. And for all of you that ask me these fiscal questions, I don't know. I go ask Erin and Dominic every time. Thank you. So, let's scoot right on into the next part. So, friends, I'm excited because today we have 211. And so, my first question for all of you is, have you heard of 211? Pull in right now. You can text PE46 to 22333. And it seems at this moment that 100% of you have indeed heard of 211. So I would love to introduce Miss Katrina from 211. Please take it away.
I don't think I've ever been in a room with people where 100% knew what 211 is. So my job is partially done for me. This is great. Thanks, y'all. Good morning. My name is Katrina Dowdy, and I'm one of the maternal and child health coordinators for 211. And 211 has existed in Oregon for quite a while, but we are revamping each year and really every month what that looks like. And my big focus is making sure that 211 is understanding the needs of the community, specifically in regards to maternal and child health and reproductive health, which I know is why you're all here. So I wanted to give you a little bit of a fun update as well, because I know Dolly is doing a good job of making these webinars fun, and let you know the real people that are going to be answering questions from your community members if they get through to the MCH team, if their questions are about reproductive health or maternal and child health. So those real people are myself, Katrina, and my counterpart, Hugo. You see us here, and I think it's really helpful when you know that the people that are in need in your community, the people that have resource questions in your community are being handed off to real humans with real answers. So that's why I just want to give you a little intro of who we are. So a little bit about me so you know kind of where I'm coming from and how I'm able to help community members of yours, including your staff. I have worked in the field of reproductive health care for about, well, over a decade now. That's been everything from HIV education and testing to reproductive health and sex ed in classrooms, breast cancer patient navigation, as well as doing some lobbying for the Reproductive Health Equity Act. So I like to think that I'm kind of able to see both small rural health care, as that's where I started, and then kind of bigger county and statewide levels, which is where I'm focusing now. So I hope to be able to really help people on a statewide platform, but also understand the needs of some rural health areas. My counterpart, Hugo, is wonderful as well. He is not only bilingual, but bicultural and a really valuable part of our team. He has previous experience in childcare at 211, which I think is really valuable when we're looking at all the pieces that affect reproductive health care and maternal and child health. So he understands a lot of those missing pieces, as childcare is incredibly expensive here in Oregon and a big part of the link in health. So a quick little info. I know 100% of you, which was great, said you knew what 211 is, but often community members and people that you're going to be working with may not. So a good little intro of what I do is I just say, as you would call 911 with an emergency, you would call 211 when you need resources. And that's kind of a nice way to just let people know what 211 is for and kind of why you would use it. So this is a map of the range that 211 offers assistance. So 211 Info specifically focuses on providing resources and connection to those resources for all of Oregon as well as Southwest Washington. Hopefully you will all see your locations there on the map. So we have one quick question here. So I have an idea of how you all know that you can connect with 211. So that's call, text, email, app, or all of the above. It started out with 100% of call, which is something, and now it's 100% of all of the above. That's always the test question. When you see all of the above, you select it, huh? Well, that is true. So now originally you could only connect with 211 via calling, and then we were able to roll out text and email, and now we have an app. So you can connect in all of the above ways. So this just shows you a little idea of how you can connect with us. It's literally as simple as dialing 211 if you're on the phone. And that will actually work, just to give you a heads up, based on maybe transient populations you may have. That 211 number will work anywhere in the US, and then it's based on the zip code that they put in where they're getting resources from. So all they have to do is dial 211. Same with texting. This text program is specifically for Oregon, so they'll just text their zip code to that phone number there. And then they can email questions, and you can do this as well, and we're able to answer them just as text. I will say the text seems to be the most popular way. Email can take a little longer, but these are all ways that we're able to help people after our normal phone hours. So our app, we had an app for the last few years, and we just did a revamp of our app. And so I think it's a lot more user-friendly now. What's really great about our app is there's multiple ways for you to search. You can search by the type of need you have. So as you see here on your screen, you could search by I'm in crisis, I need food, I need help paying my bills or transportation. So you can search for a general category. And then there's also a spot where you can type in search questions. So specifically if someone's needing something like a pregnancy test, they can search pregnancy test. And what we have in our database are locations with free pregnancy tests around them. So just a little bit of an idea of some of the work that we do and what that's looked like for the last fiscal year. Quite a good number of calls, web visits, mobile app searches, and text. I will say that our mobile app was down for a month or so as we were doing that big reboot, so I expect to see the numbers to be even higher next year. And text just seemed to be increasing as people understand that that's a resource that can work well for them. So, there's a lot of needs being solved and people finding resources in these ways. So how robust? Here specifically, what we're looking at is how many agencies are in our database and the types of resources they offer. So a vast number of agencies offer more than one resource, and so that could be in the shape of shelter as well as a food bank, as well as occasional immunization clinic or something like that. We recognize that most community organizations try to address a lot of needs of their communities, and so people are listed for lots of different services. What we would like to do is see if if your organization is listed in the 211 database, as most people are probably calling in from public health departments, and those should be listed in one way or another in our database. Okay, so about 75% of people said yes, I am in the 211 database, and 25% said not sure. That seems just about right. So I just wanted to show you real quick how you could go about looking this up. It's as simple as going to 211info.org, and then you would click here on local community resources. And this is also what people that you're referring to 211 can do. So they could go here, type in their zip code, age, gender, and the reason that we ask for those things, although they are optional, is some services are, certain age requirements or certain genders, specifically shelters, are a little more gender segregated right now. So that's one way. If you wanted to take a quick minute, we would love to see if you can make sure that your agency or an agency that you know that might provide the care that you no longer provide as far as reproductive health. We just want to make sure that they're listed in the database. So just take a quick minute and do that, and I'll show you how to let me know if it's not. Okay. And as people are looking up to make sure that their agency is in the database, we have one more question, which is just as important, if not more so. Is your organization's information up to date on 211? So, some of the feedback that we get, for example, are folks being concerned about referrals, their agency may or may not be in the database, and all of that can be solved. We do yearly updates, and so we reach out with a minimum of 5 times to agencies to try to update their information. And so we want to make sure that things are up to date and that we're referring accurately. It looks like 100% of people said their organization info is not up to date on the 211 website. Oh, and now it's 50-50. So the thing you can do is, we're switching around still, but people are checking, which is great. So we want to make sure that we can provide the most accurate information to folks in the community. So something like a quick little check, just as you all did, to see if your agency and community partners are in the database and if the information looks right. And that's information from phone number to address to hours and population served. We want to make sure that's accurate, and there are forms on our website that you can fill out. I can definitely post a link to that for you all too, where you can let us know any errors that you've found and who the best person is to make sure we can get accurate updates from here on out. So thanks everyone for checking that. I appreciate it. This, kind of ties into what we were just talking about. We want to have a robust and accurate database. In fact, we get scored and graded on that, and we are held accountable for making sure that everything is as up to date as possible in our database. So as an example, this is if a caller is calling in the zip code 97444 and is looking for baby furniture, one of the resources that would pop up is the Oregon Child Development Coalition Central Office. And specifically, this is the Cribs for Kids program. And so we just are using this as an example today, as this is definitely connected with maternal and child health, as well as the big scope of reproductive health for many folks. And we want to ensure that families have a place to have their kiddos sleep. So this is something we update yearly. Some contracts have a 6-month update, but this is kind of what the screen would look like for our folks on the phone. I'm providing information. And what I wanted to show you is how detailed that information could be. Some folks are worried about listing in the database because maybe they have very specific eligibility. Maybe they're only able to serve women from 20 to 40 and women who specifically live in Clackamas County. That can be under our eligibility, which you'll see right here. And we can have as much or as little detail as needed in there. So we can also let people know, if you look a little farther down, it'll show you languages that are spoken at this location, and also transportation is listed a little farther down. So we can let people know, oh, just hop on the 82 bus, and that's how you'll be able to get there. So we really are trying to meet people where they're at and help reduce those barriers to care, which I know is what you all are focused on as well. So just as a quick idea of what are the top needs that we're getting from callers with 211 every year. This probably isn't a surprise to anyone on this line, but we get the number one request is rent payment assistance. 2 is electrical payment assistance, especially in winter. 3 is community shelters, which is very closely tied to 1. When those resources aren't available with rent payment assistance, then people need to find other shelter options. 4 is childcare. We'll talk a little bit more about childcare further on in the slide, but that is a large need throughout the state. And then food pantries. And these are the top 5 needs of callers throughout the state. And they're not specifically calls that come in through the maternal and child health line, but they directly affect maternal and child health, and they directly affect reproductive health. If someone doesn't have housing, they're going to have difficulty accessing the kind of quality care that they need for reproductive health and the services that are available. And so when we're talking broad scope, upstream healthcare and resources and quality of health, we just want to point out that all 5 of these needs aren't directly reproductive health, aren't directly maternal and child health, but most certainly affect all of the above. So another thing that some people have voiced concerns about are demographic questions. I know some callers wonder why they're asked so many questions when they call 211, and that might be feedback that you've received in the past too. And so I'd just like to take a moment to clarify why that is. First and foremost, anyone is able to say they don't feel like answering these questions, and that's perfectly okay. However, there are a lot of programs that are either specially designed for a select group of people, like say NARA or NAIA, which are specifically for the Native and Indigenous population, or things that maybe have age restrictions or household restrictions like children or no children, maybe income limits. So that is why we ask some of these questions. Again, someone can refuse to answer those, and that's fine. We just really want to dig down to make sure that we're finding the correct resources that fit the needs and what someone is qualified for when they're calling. So one quick thing about 211. So if someone calls 211 and they're just calling the general line and not one of our specialty lines, you're going to get someone that's called a CIC. And that is part of the Community Information Specialist realm. They're folks that are reliable and trusted. They're actually trained and certified through the AIR system, which is the Alliance of Information and Referral Systems, quite a mouthful. And what we focus on is, kind of really hearing what people are saying they need, but also trying to dig down a little deeper and see if there's other things that could be helpful. For example, just yesterday when I was giving a presentation, someone asked, what happens when there aren't housing resources? And that's a real question that happens a lot. So someone will call in and they will ask specifically for rent assistance. And we unfortunately will have to tell that person that for their zip code where they're located at this time, there's no rent assistance. The call shouldn't end there. One other way that we're able to help people in a kind of creative problem-solving way is by asking what are other things that could be helpful for them, because we know sometimes if food is less of a concern, if other like transportation barriers can be met, then maybe some money can be freed up for rent. And so that's ways that we and our staff try to problem solve to reduce some of those barriers for folks. So just a few of our specialty programs, and just a reminder as we're going through this and you're hearing a little bit more about what we do and the resources that we offer. If questions pop up, you can type them up at any time and I'll be happy to answer those. But as far as specialty programs, we have quite a few. Childcare is a big department for us. There's two parts of our childcare team. One part is entirely focused on working with childcare providers and making sure that their information is up to date and we know how many openings they have, we know what kind of programs they offer, who they're able to take, and what kind of funding they're able to receive. Then we have another part of the team that specifically works with people in need of childcare and helps refer them to the correct provider. So that's a great team, and they're familiar with navigating DHS payments as well as, maybe like emergency situations with childcare. We do have a lot of requests of people who are going to be needing childcare when they deliver, for example, and our staff is familiar with looking for that type of emergency childcare. We also have foster parent support. Right now that is a team of people guided by a foster parent lead, and they have extended hours and are able to answer a 24/7 line focused on foster parents and any urgent needs they may have. We also have a SNAP food assistance specialist who focuses on SNAP, food banks, food pantries, as well as, food barriers that might exist for folks. Right now she is focusing also on the new kind of one system that may be happening with SNAP. Then you have my department, maternal and child health. I will say, relatively speaking, we also feel that is not a comprehensive title for us. We focus on reproductive health care and however that might look. So we focus on reproductive health care, maternal child health, child education, kind of everything that fits under that realm. We have a ScreenWise program specialist who focuses on breast and cervical cancer and helping people navigate ScreenWise. And then coordinated entry, that is a housing solution system. We have a few different coordinated entry systems. One is Linn-Benton-Lincoln County, and one is Multnomah County, and there may or may not be more on the way. But what that is it's a collaboration to help people navigate houselessness and figuring out housing solutions. And then emergency services, and those can range. We have been on call for certain fires and certain emergency situations in the community. And so sometimes we coordinate with the state or FEMA to help with that. So, oh, we have a question. One sec. Does our SNAP person have WIC knowledge as well? They do. They personally have experience with WIC and, navigating that. I will say most of the WIC questions do come to maternal and child health. That is a good percentage of the questions that I answer. So they would be able to let people know where their closest WIC office is and search that in our database and problem solve for them. I will say if most people say they have a WIC question, they just end up going to the maternal and child health line, but either one of us should be able to help that. Great question. Keep them coming. So here we are at our program, which is maternal and child health. We have a contract that serves the entire state of Oregon. That means that technically our contract doesn't cover Southwest Washington, but I will say if those calls come in, I still answer them. We have bilingual specialists that are able to offer resources for folks. And if someone speaks a language other than English or Spanish, we utilize interpretation. So it's a pretty seamless access to resources that way. So we focus on information for children's health programs, including physical, mental health, drug and alcohol treatment, prenatal care, postnatal care, postpartum support, and that can mean a lot of different things as far as postpartum. That could be also access to things like all options for post-termination resources, abortion care, kind of the big scope of what maternal and child health and reproductive health mean. WIC and breastfeeding support, basic needs as far as formula, diapers, clothing. I will say that formula and diapers are pretty big needs throughout the community and definitely can be really hard to access when you get outside of Multnomah, Clackamas, Washington counties. And we do have some great resources in places like Yamhill County. I found some great resources in Salem. But if you know of wonderful resources in your community that are able to provide support for things like formula, baby clothing, diapers, car seats especially, we're having a really hard time finding folks access to resources for car seats across the state. Definitely just check our database and see if it's there, and if not, again, I'll show you how to send a request for a new listing, and we can definitely add that because we want to make sure we have those resources for our families in need. Another big referral that we give is for home visiting programs. That can be like Babies First or Organ Mothers Care, and those make a huge difference for people. I do want to point out that the term home visiting can be a little misleading. Someone does not need to have a home to be a part of this program. There can be creative problem solving for folks, and especially those folks with higher need that may be finding themselves homeless and houseless at the moment can qualify for these programs. So I'd just like to clarify that real quick. So as far as reproductive and sexual health, again, this is the state of Oregon, and again, I still will answer Washington calls. This is everything from pregnancy testing, fertility services. We definitely have people calling and asking for abortion resources and access. As you all probably know, that access is limited throughout the state, so most often it is not only letting them know the closest location, which may be in Portland, which could be a whole day's drive for them, but then I also help navigate, do you have Oregon Health Plan? Here's how that can help you cover transportation cost and things like that. So there is a little bit of care navigation that happens for a lot of the resources in maternal and child health and reproductive and sexual health. We get quite a few calls for fertility services. I will say most of the calls for fertility services tend to be from uninsured folks, and most likely they're not going to get access to the treatment that they want specifically, but we do have quite a few fertility services listed, and they're welcome to contact them if they want. It can just be a little tricky without insurance. STD and HIV testing, we've been getting a lot more calls from that. We also answer the Multnomah County STD and HIV line, which people from all over the state actually utilize. And in fact, people not in the state, we get a lot of calls from Texas, weirdly. I think people just Google STI and HIV phone line and call us. What I will say is really important, and this is where this webinar specifically comes in PE46, is if your public health department no longer offers these services, it is incredibly hard for us to know who picks up that slack and kind of who is now offering that service. And so that's where it's going to be vital for you to make sure that those community partners that are now doing the STD and HIV testing understand, who can get care. We're getting a lot of people that are getting turned away for care and having difficulty with the potential cost at places like Planned Parenthood and not really understanding what programs they might be qualified for. So definitely screening for programs across the state and, helping us bridge that gap by letting us know who is offering these services in your community is incredibly helpful. Same with contraceptives. So between like RIA and C-Care and things like that, we do need to know who the clinics are in your area. I know the state has a wonderful list that we utilize to make sure that our database is up to date, but those things are always changing. So if you can keep us and the state up to date, that's super helpful. And then vasectomy and tubules. We have gotten a pretty decent increase of people who have been looking for tubules recently, specifically folks that now qualify under the Reproductive Health Equity Act and that new funding and coverage. And so it's just important for us to be able to refer correctly for that. Right now, we're kind of in a situation where we're saying, your health center or your hospital should be able to do this procedure, but we don't have a solid list of who can do tubules and give information out for tubules in that way and do the prep and the counseling. So if that's something that a community partner does, we'd love to know about that. And last but not least, HPV vaccines. We have been getting a lot of calls about that, especially as more folks are understanding that this is a very helpful vaccine for people other than those born with a uterus. And so the more that it's being promoted, the more questions and calls we get about where to access that kind of resource. And so just important to update that in your system as well, if that's something that you provide. So just real quick, we already touched on childcare. I'm going to go through each of the specialty programs just real quick for you. But this is specifically for the state of Oregon, and they partner with DHS and Early Learning, as well as a lot of the local childcare CCR&Rs. And what I do really like to point out, if you look at the bottom of your screen, is the extended hours. So for example, myself and Hugo, we sadly cannot be on the phone for this level of hours for maternal and child health. That's just not possible for us, but childcare has an amazing large team that is able to understand that childcare needs happen outside of typical business hours and has staff and funding for that. And so they have a pretty wide range of hours, as you see, Monday through Friday, 7 a.m. to 11 p.m., and then Saturday and Sunday, 8 to 8. So people are able to access childcare needs and referrals for a good majority of the week. The foster parent program, again, has a wide range of hours and after hours times. It's technically 24/7. And they can do everything from triage crisis calls to really just having questions from foster parents about maybe supportive meetings, community resources, things like that. One thing that is important for you all to know, because all of this also affects maternal and child health as well as reproductive health, is access to some of our seasonal programs that can really support families in your area. So that can range from backpack drives and school supplies right around this time of year to holiday assistance. That has already started. Sign up list, fill up fast for things like turkey dinners, toy drives. We have lists throughout all of Oregon where people can access these resources, and you might know families in your area that could benefit from that. And so they're able to call 211 and get signed up for a program if they'd like. Same with kindergarten assistance and registration. That is something that the maternal and child health team, we take the lead on, and then child care can follow up with if they need and if we're out of the office. But we can help people in Multnomah, Washington, and Clackamas County find their correct kindergarten for their address and let them know how to do registration for that. Typically that's in the fall and spring. For all the other counties right now, we don't have contracts set up and we don't have the level of detail that we need to help people find their assigned school, but we are able to give them their school district phone number and then they can call the school district for registration. Coming up in just, a little bit, is tax preparation assistance. So we do help people find tax prep assistance. That'll start in just a few months. And then farmers markets, SNAP sites, and cooling shelters. Severe weather shelters is something we help people with kind of whenever severe weather is called. I will let you know that that season is coming up and we've already started prepping our staff for that and connecting with community partners. So if you have severe weather shelters in your community that you would like listed, please reach out to us. And real quick, something that I want to let you know that could be really beneficial to you, your organization, or potential grants that you might be writing are some reports. So we are able to run reports that have been really helpful to community partners in the past. One big way that that could be helpful, for example, is you could find how often needs are left unaddressed with callers. So if a need exists and the resource doesn't exist in the community. So for example, diapers. If someone is calling looking for diapers, formula, and car seats, and none of those services are listed in our database as having resources in your community, that will pop up as an unaddressed need. And so we can search for those unaddressed needs and create reports, and that has helped people justify different kinds of grants, different kinds of programs to show what their need is in their community and how best those needs can be addressed. So we can also look at top 10 services requested. For example, with maternal and child health, it's often WIC, pre-postnatal care, reproductive health service, HIV and STI testing. Those are kind of usually some of the top things. And so, yeah, potential gaps in service is a big thing that I think is kind of reverse mapping, which could be really important as we're looking at how we can best focus on, modernization, filling the gaps of what really affects healthcare in a community. And that is it for me. Just a little brief overview of 211, what I do. I am one half of the duo that your community members will be able to talk to if they get through to our maternal and child health team. And that's as simple as dialing 211 and selecting the option for maternal and child health. Thank you all. Any questions, feel free to type those out now. Okay.
Now is an excellent time to ask questions. Should you have any questions for 211 and Katrina? So I just want to say thank you so much, Katrina, for being here today. Part of the reason why I wanted 211 to come is, quite frankly, I have heard a lot of people talk smack about 211 all across the state, and how, well, 211 doesn't work in my community, like my information isn't up to date, this, that, and the other. And what I found out was that 211 gets a lot of money to make sure our information is out there. So as a PE 46 coordinator, I am challenging you all to go to 211's website to make sure your information is up to date. If you see community partners whose contact information is not listed on the 211 webpage, I encourage you to engage them. What Katrina and I have just done for you now, I am assuming is easily duplicated. Thus, we could be in each of your communities sharing the 211 gospel and trying to get more people to make sure their information is correct. And part of the reason why I say this is important is none of you as PE 46 coordinators and possibly reproductive health coordinators maybe care, but the people on the ground doing the work certainly do care. So when I was working as an enrollment assister or as a community health worker or a health educator, all of these various roles, I would go to 211 often to find resources for my clients. Housing, food, childcare, it doesn't matter. People are in need. So one thing you can do to help those individuals in your community who are doing the work on the ground level is to make sure these information and resources are up to date within your community. And if they're not, reach out to us. We will make sure that this gets you get the information on how to do that. And in fact, Katrina did a really great job through multiple slides telling you how to do that. So hopefully you all can do that. So let us move right into our next poll since we had no additional questions. Do you have a better idea of how you and the populations you serve can better utilize 211 info? Yes, no, or you want more information? I'm seeing a solid yes. I have better ideas on how you and the populations you serve can better utilize 211. Awesome. So, as a reminder, you can always go to the PE 46 webpage to get additional information. This webinar will be posted to the PE 46 webpage within 7 days, maybe 10 if I can't figure it out again. Sorry about that. You can also access the Reproductive Health Program's webpage for additional resources and information. Here's my information. As always, email me, don't call me. Oh yeah, we have a short URL for our PE 46 page, so this slide needs to be updated, but it's now healthOregon.org/PE46 if you need the cheat sheet /. Always email me instead of calling me, but there's my information. I appreciate each and every one of you. Thank you for participating on yet another rockin' PE 46 webinar. Please stay tuned after I end this webinar for a short survey. Your feedback is appreciated. Thank you all.